Do you have bulging discs in your neck? Is your pain so severe that you think you need an MRI to figure out what's going on so that you can fix it? And does this situation have you worried and scared? Appropriately so, because of how big it is and what that could mean for your world and for your life. Stick around. I am about to interview somebody who is in those exact shoes, and she found her way out without an MRI, without an injection or expensive procedure or drugs. She has totally figured out how to take care of this without all of that. I'm doing an interview with her to shed some light on her journey and how she got from point A to point B, and maybe you can do the same too. All right, well, welcome. This is Marcus, and this is Sarah. And Sarah, I have to say, I was like almost moved to tears with inspiration hearing your story. What I want to do is ask you some questions about where you were with your neck. Like, what was going on, and why do you think you were there? Mm-hmm. And then where are you now? Mm-hmm. And how do you think you got there?
Yeah.
So, let's start out with, where were you when things were at their worst? What was it like? What was going on? What was your understanding of it?
So for me, at its worst, I mean, it was gradual. And with my neck, I just remember I woke up, like as I'd wake up in the morning, it would get worse. And then when at its peak, it was debilitating, where I would wake up and my neck I would be in so much pain. And since I have fibromyalgia as well, it would trigger my nerves. And then I would be in so much pain, I'd actually vomit from it. Multiple times, like all day, I'd be out. I'd have to call out from work, and it was just awful, and nothing would help. Medications, like heavy-duty things, didn't help. I just would kind of have to wait it out till about 4 o'clock. Usually, it's weird. It kind of goes away, and it got so bad that it was kind of happening like 2 to 3 times a week. So, yeah.
So you'd have neck pain here, it would radiate through your whole body, up into your head, you'd vomit.
It's awful on the left side,
okay.
And that's why, I mean, I've had different people feel my neck thinking that it's multiple bulged discs in the cervical area, and just pinching the nerves off in my head, and it would be awful. I would try to do anything, heat, ice, medication, and then it would, so it would start here, and then I'd get nauseous, and then my fibromyalgia, my whole body, I would just feel like I got hit by a train after, so,
I can feel it right now.
Yeah.
That feels awful. I'm so sorry you had that going
Yeah.
on. And so then when we met, it was like, can you feel my neck? I think I need an MRI.
Yeah.
Right?
Mm-hmm.
And then what ended up happening?
Well, I was really wanting to get an MRI and just to figure things out, and then you sent me those videos, the one with the breathing, to calm down the vagus nerve, and so I was in tears that morning, and I texted, what should I do? And he sent me that, and I was like, okay, I'll try it, and I tried that breathing one, and then it just started to slowly, like, not be as intense. And then I did it like 3 times, and then I could function, and I could go to work, and I didn't feel nauseous anymore, and it was still achy, but it wasn't like intense anymore. And then sometimes when I do it now, it goes away completely, and then if it's really bad, it takes the edge off, and I can function.
Okay, so let me get this straight. You had seriously debilitating neck pain.
Yes.
You're a massage therapist.
Yes.
You couldn't work.
I couldn't.
That's a big freaking deal,
It's a big
folks.
deal.
That is a big deal. Like, if you can't work, mama can't bring home the bacon, no rent, mortgage, like scary stuff.
Oh, scary, because I own my own business.
Yes.
So that's even scarier.
Yes, seriously. So it's like, I gotta get an MRI to figure this out. Did you ever get an MRI?
I didn't.
Oh
I
my
didn't
God,
get
folks, I
one.
have goosebumps. She didn't get an MRI. She found an exercise where
Yeah.
you took back your power,
Mhm.
right? Because it's like, I need to make this better.
Mhm.
And I can, and I did.
Yeah.
And I didn't need to go outside to
yeah.
some expensive procedure
Oh,
that
yeah.
may or may not actually help or
Oh, I
solve
know.
the problem.
Mhm.
Am I getting all of this
Yeah,
right?
absolutely.
This is freaking cool, folks. You saved yourself $1,500.
Yeah.
You're back to work.
Mhm.
You still have pain sometimes, but you can do the diagonal breathing
Oh, yeah.
technique to calm the vagus nerve
Yeah.
and lower your pain.
Mhm.
This is profound.
Yeah. No,
Okay.
absolutely was profound for me because, canceling clients and then, that's less money. And then having to go to a doctor, get an MRI, that's more money. And then say they wanted to do surgery, which a lot of them with cervical issues want to do some sort of injections or surgery. And I don't have the money for that.
Okay, so you did some weird, silly, simple
Yeah.
little breathing exercise that
Uh-huh.
redirected your trajectory out of a trajectory
Mhm.
that was going to cost you a lot of money because you're not working.
Yes.
Was going to cost you a lot of money because of whatever procedures were going to be necessary, MRI, physical therapy,
Oh,
surgery, etc.
Mm-hmm.
And now you feel better.
Yeah.
What advice would you have to give to somebody who was in your shoes?
Well, one, if they're watching this video, they should come see you. They should talk to you, at least give you a call. But see somebody first, like Renee, or and see someone alternative, and try this breathing technique first before you do anything. Try that breathing technique because it really saved me. And I honestly was like, this isn't gonna work. I'm in so much pain. I take, I take like Vicodin, and it wouldn't hurt. It wouldn't help. It would still be in a lot of pain. And I was like, okay, there's no way. So just try it. I was in shock when it worked. So try that. Give her a call. Don't immediately go get an MRI because she knows I was bent on getting one. I was like, I need to get one. I'm sick of this. I want to know what's wrong with me. And so I can make a plan.
Totally.
So, and then I didn't get one. So. Yeah.
All right, folks, save yourself $1,500, a whole lot of neck pain, headache, hassle, and money.
Yes.
I'll put a link to the diagonal breathing exercise video in below. Thank you so much for showing up today.
Absolutely.
All right, have a good day, everybody.